Hey everybody, Foley Fitness here, the place where we talk all things lower back pain, prevention, and management. Today's topic is spinal stenosis. Spinal stenosis is a term that describes the narrowing of the spinal canal where the spinal cord is, or the narrowing of the vertebral foramen where the nerve roots exit. Lumbar stenosis generally occurs as a result of aging, standard wear and tear, or injuries like a disc bulge or herniation. You see, as we age, our formerly plump intervertebral discs slowly start to dehydrate. And as they dehydrate, they're also going to lose height. When disc height decreases, this places extra stress on the posterior joints and ligaments of the vertebrae. This extra stress can cause them to become lax and therefore less supportive. To combat this process, your body will attempt to add stability back to this area with things like thickening of the ligaments, like the ligamentum flavum, and bony outgrowths around the facet joints, around the rim of the vertebrae, and even in the actual spinal canal. This can become a big problem when we look at a comparison between a normal lumbar segment and a stenotic segment, where we can see significantly less room for the spinal cord and nerve rootlets to move freely. This lack of room is what causes the nerves to become inflamed and therefore painful. But there is some things you can do to help with your symptoms. But before we go over that, we need to make sure that you understand what spinal flexion and what spinal extension does to your spine. Extension of the spine is going to further close down the vertebral foramen, while flexion of the spine is going to open them up, thus giving the nerves more room to flow. This is why walking after a period of time tends to irritate stenosis, whereas sitting tends to relieve it. Another common example is somebody with stenosis leaning on a shopping cart instead of carrying a basket, because the shopping cart provides a little bit of flexion for the spine, and that opens up the nerves a little bit more so they have more room. Now, with all that being said, we can boil this down to two main objectives. Number one is postural awareness, and number two is rebuilding stability in the spine. Postural awareness is understanding that certain positions and movements are going to flare you up more than others. And that while generally extension is an irritant, it's not something that we can just eliminate because our spine needs to move. With that being said, here's a few common irritants and how to work around them. Number one is unfortunately walking. But two things you can do to help get you out of a pinch is intermittent sitting breaks and a spinal decompression, aka the park bench decompression. For the park bench decompression, all we need to do is find a surface that is roughly hip height. A little bit below or above won't kill you, but it's not as ideal. So we're gonna start by turning our hands inside out and anti-shrugging our shoulders. So that means instead of shrugging up, we are going back and down. Once we do this, we want to maintain some tension in the upper back, and we are going to grab onto the surface and walk our feet backwards. From here, we're gonna let the weight shift from the toes to the legs, and it's just gonna be dropping straight down. So the weight of your legs is gonna help pull and decompress that spine. Make sure that you are not flexing in the abdominal area. This needs to relax. Just focus on breathing in and out with deep breaths. Now keep in mind, spinal decompressions will not feel good to everyone. So try it beforehand to see if it works for you. And secondly, we have sleeping positions, particularly those with prolonged extension, aka stomach sleepers. This position is going to encourage the lower back to relax into extension, putting more pressure on those nerves as we sleep. And with all that being said, the two positions that you'll likely find the most relief with is back sleeping and side sleeping. Now, if you're someone who finds back sleeping irritating, there is something we can do. We can add a pillow underneath of our knees. This is going to prop the legs up a tiny bit, and it's going to help push our lower back into a slight bit of flexion. Depending on how much of a curvature you have in your lumbar spine, you can have a little bit of extension even when laying down. So this pillow helps to reduce that, and this might make it a comfortable position for you. Secondly, we have side sleeping. A few things we can do here is we can put a pillow in between our legs. This is going to help keep our pelvis and legs nice and neutral so you don't start to drip forward, putting more stress on the lower back. We have a very slight amount of hip flexion here with the knees bent in order to kind of take some of that stress off the nerves. And we don't want to be too far up because then we're going to be tightening up the hip flexors, and we don't want that. Now, when we look at the lower back, if we can put a small towel or small pillow or shirt or something to kind of bolster that up so the lower back doesn't sink into lateral flexion overnight, that can help as well. Now, this is going to be more relevant for the people who have like a very small waist and wide hips. Firm mattress can definitely cause some irritation with that combination. And finally, we would want to have a pillow here that is not, again, forcing our neck into lateral extension or lateral flexion by being too big and bulbous. Just make it where you are nice and neutral with the neck. And finally, for spinal stability, we are going to go over my top 5 least favorite exercises and stretches and what you should be doing instead. Number 1 worst exercise for stenosis is the Superman. And as our first alternative, we have the bird dog. This exercise is excellent for learning to stabilize the spine with the hips and core. For this, all we're going to do is go into a quadruped position. So shoulders stacked over the hands and the hips stacked over the knees. So all we're going to do here is extend one arm while simultaneously extending the opposite leg. So what it's going to look like in practice is extend and extend. We are going to focus on the squeeze of the glute and the squeeze of the hand at the end. I want you guys to hold this for about 2 seconds on each rep and come back. Get a nice brace in the core as well. Not too much because we're not under load, but just enough to, again, help stabilize the spine. Big thing here is kicking directly back. If we start to come up here, this is going to put our back into extension, and we really want to focus on the spine being in a nice neutral position while we do this. And number 2 is oblique twists and side bends. And for our second alternative, we have the side plank. This is a much better exercise because it forces the hips and core to work together to resist lateral flexion. Now, the only problem is this can be kind of a difficult exercise to start with. So one way we can regress it is by bending the knees and then going directly up into the position. Again, this is going to be a lot easier to start out with. And number 3 for exercises to avoid is things that are high impact. So running, box jumping, burpees, jump rope, stuff like that. And just keep in mind that is a general rule that may not apply to everyone, specifically those who have a very low-grade stenosis. Instead, a much better way to work the hips is going to be with the hip thrust. Now, this exercise can be great or it can be painful if you don't abide by the cues. So we need to make sure that when we are thrusting up, we are going to the end of our hips. So we're basically in a line from the shoulders to the knees. Now, if we go any higher than this, that is going to put our back into end range extension, and this is where things start to get painful. So we need to make sure that we're just going to the top of our hips and back down. As far as your foot position, just have it at least like a foot, your heel a foot away from the butt, and that should be fine. And number 4 is Cobra Pose variations. Now, the Cobra Pose generally works well for people with disc herniations, but however, we know that with spinal stenosis, when we go into end range extension, that is going to close down the room for our nerve roots to move, and that is going to be irritating. So instead, a great movement to help us go into extension and flexion is the cat camel. This is much safer because we're not forcing our back into any position. We are simply entering into flexion and extension for about 5 to 7 repetitions of each. This is a great way to help maintain that mobility in the lower back. And number 5, last but least, we have the foam rolling the lower back. Now, the foam roller can be a pretty decent tool, but we have to understand our lower back already has a natural lumbar curve. So shoving it into our lower back, trying to accentuate that, isn't going to do us any favors. So instead, our much better alternative is the child's pose, one of my favorite stretches, great for the lats and the lower back. We can have our feet bent or flat, whatever one you prefer, but all we're going to do is walk ourselves slowly down the mat or whatever you're stretching on, and really just focus on that deep stretch in the lats. Again, try to stay loose, just focus on the inhaling, exhaling deeply. And if you really want to, you can turn it into an active variation by putting your hands on top of the foam roller, and we can go in and out with this variation as well, and that can help us get a pretty deep stretch in the lats as well. If you have any questions or comments, leave them down below. For everybody else, like, subscribe, and have a great day.